So no problem at all. Okay. So yeah, as I've been telling, we need to think of every day new, and yes, very little new, but know the new. Neuroplasticity is very important. Let's give more importance to neuroplasticity, especially the brain. Why is it important? Because we have millions and millions of neuron cells asking for information every day. So it's up to us to give the feed to those neuron cells. And we should never think of the neuron cells which are damaged, because whatever has damaged doesn't mean the whole area is dead. The surrounding area will be ready to catch up with the next area. So we should be ready for it. And when will it catch another dendrite? Only when we feed the brain. Then only it will catch the other neuron cell. That's why so many experiments were done, thinking that the moment the brain is being removed or a particular area has been removed, then that whole area will shut down. But never it has happened in many experiments. So neural capacity, neuroplasticity, the capacity of brain cells to change in response to intrinsic and extrinsic. So now what am I doing? My brain is what is telling me whether to lift the finger, drop the finger, okay, open the fingers, things like that. But in case of my brain damage, so what do? I forcefully lift my finger and keep telling my fingers, get up, get up, get up. So the moment I lift my fingers, then this is the information which will go and hit the brain. So intrinsic is brain to the muscle, extrinsic muscle to the brain. So I keep forcing myself to drive. So brain will say, okay, Lakshmi can drive. I keep forcing myself to run like a cheetah. So the brain will be saying that, oh, Lakshmi can run like cheetah. So it can happen. That is brain. That's what is the logic behind hypnotism also. There are a lot of experiments. A simple experiment is the hypnotist will directly ask you to put your hand from here to how much ever you can extend. Yes, we did this. Then they will say, look at your hand and say, you can extend even till your back. Then I have to look at my hand and say, please extend till my back. So automatically my hand will go till the back. Okay, this is the power of brain. That is how hypnotism works. You should feed your brain every day. So what else we have? Yes, we have degenerations. That doesn't, see, as the age grows, we get white hairs, wrinkles, memory loss, many things. So I get hurt, so the skin scar will be remaining for a longer time because I became old. No more repairs. So it's okay. So what happens in neural degenerations? Deterioration and loss of function for the motor system. The cells and nerves in the brain and the spinal cord which control the muscle in our bodies, which results in weakness and wasting of the muscle, right? So what happens once the nerve gets degenerated? It will not be able to give information to the muscle, not actually very active. So what happens? Because the muscle is not receiving anything very seriously every day, so it will relax. It is not anymore active and not strengthening. I'll give you an example for this. If I'm into gym, for example, I keep giving some work to my body all the time. I'm giving information. So it will say, muscle, come on, bulge up, get up, move it, bulge it. It will become fatter and fatter, and that is what is that bulky bodyguards. And then what happens after a certain age, or you get bored of the gym, or you have too much of work, no need of gym anymore. Then what happens? No information, no work, the muscle is weakened. So no more that bulky body. What happened? You haven't given any information to your muscle. So that itself shows that we need to always give information to the muscle. The more we give, it will act. No information, degeneration. Okay. So the major form of MND is amyotrophic lateral sclerosis. Amyotrophic, it's muscle. Okay. The degeneration condition involves degeneration of motor neurons in the neocortex level. Cortex is the main, it's like a head office kind of thing. Brainstem and spinal cord, main branches, which will spread the information to another level. So what happens to all these things? Pruning happens. So what is pruning? Pulling up anything back is pruning. Nowadays, we get a lot of children with autism. What is happening in them is they are born with billions of neuron cells. By 1 year, 1.5 years, they talk very well because biological growth is too good and all these neuron cells are helping. After 1 year, either they get gadgets or they are left with IMA, or parents are working and very busy and they are in baby care centers. So because of very less stimulation to their brain, these neuron cells are, instead of 80 billions, they might become around 20 to 30 billions. Another thing what happens is LED screen or some very active slides will be going on, YouTube channels and things like that. So all these 20 million neurons are active and then suddenly they're dead. Because anything which goes hyper, the next thing is relapse. It will die. So that is pruning happens. Everybody. But doesn't mean it will not reactivate. But when to reactivate? Immediately, not too late. So you need to understand that muscle giving information, brain giving information to the muscle strengthening. Brain not giving much information to the muscle is weak. Okay. So how can we regenerate this neuron muscle? Can you see the picture carefully?
Yes, ma'am.
Can you all see this pink color cells? These
Yes,
pink
ma'am.
colors.
Purple color.
These are the cells which will help you regenerate your nerve cells. Okay, regeneration happens if you keep continuing the nerve cells to go touch the muscle. Okay, when peripheral nerves are injured, the damaged axons regenerate vigorously, repair, and can regrow over distances. Distance, okay, you need to mention that distance. It can. It depends on how much power you are pushing to. Many centimeters and more under favorable circumstances. These regenerated axons can also re-establish synaptic connections. Just growing longer and longer, no point. But connecting to another nerve cell by giving a synaptic connection, then the success is seen. Okay? Studies now demonstrate molecular and cellular changes in DRG sensory neurons, and it can be induced by exercise. The benefits of exercise can appear quickly as seen in the improvement in regeneration after nerve injury, following as little of 3 or 7 days of exercise. Many a times we see stroke patients, suddenly they are under stroke. Within hours, we need to give particular injections. Particular cells will be going into their brain to regenerate and re-repair. It is not like, as I said, it will go and repair. No, it doesn't happen that way. Each nerve cell will be helping each nerve cell to tell that go repair this, go repair this. So it takes time. But just because it takes time to repair, we cannot take time to give the medicine. Medicine has to be immediate. Repairing is the one which will take its own time. So for within 1 week or 10 days, we see many of them uttering words, trying to say hi and recognizing people. Lot of nice improvement. Family and we keep thinking that, wow, he's recovering and good, he will be soon back. But suddenly what happens? It will go under a plateau. No more regeneration happens unless we treat it as early as possible. Because as you see, the pink cells will help increase the length of the nerve cells from centimeters to centimeters to connect. Any break in that, again we had breaks. Okay. So,
Ma'am, can I give a short example?
yes, why not? Sure.
Yeah. So please go back to the last slide, ma'am. I would like to tell everyone that when we are depressed, when we are sad, at that time we come in contact with our friends, and friends make us happy and jolly. These cells are like that. Correct, ma'am?
Yeah, great. Exactly. Yeah. These cells, yes. As you said, truly, we will also talk about it. Not only these cells, there are people who can give you these cells. Okay. So the plasticity, how will it work? If you see this baby here, the brain of this baby is getting stimulated only with one leg because amputated. She's been amputated. But slowly sorry. But slowly what happens is if you stimulate the leg in different areas and if you give little more information to the other leg, the information spreads in so much and such a way that though she is amputated, the brain thinks that she has a complete leg. Okay, so that is the capacity of brain. That's why people can do many things which we think as impossible. Nowadays, you must have seen youngsters going on the bike, just riding the bicycle up and then take 2 circles and then they land very safely down. Can we really imagine something we can do? Can we do something like that? No, we keep thinking, oh, how can a human do such a thing? But they're doing it. Only thing is brain balance. Imagining and stretching themselves to do the work. Okay, so the more you process, the more you send the information, brain is ready to take it. So neurological and neurodegenerative diseases in parts of the nervous system can affect brain networks. And how these networks can compensate the following damage is the main logic. This work helps them understand how the networks that control the movement work and how they influence and are influenced by different disease mechanisms. Okay, so particular areas, particular degenerative diseases need to have certain information from different cells. Then they are the one who will push. For example, amygdala or hippocampus. Amygdala and hippocampus are the main areas which are responsible for our emotions. Generally, I'm happy. Okay, fine. Because Saturday is a party time, Sunday is a holiday, Monday only I should think of anything else. But if something tells me that you need to travel or you need to do something, you need to meet somebody very important, and then my brain will be like, oh, okay, I need to do something. So who is that? Oh, that emotions shift of happiness to something I really need to concentrate and do the work on is amygdala. And this is important even in children and the geriatric old adults. Why is it important? Because in children, only when they cry, the mother comes and lifts the child, then they'll connect. Okay, I cried, mother came, and I'm happy. I cried, mother came, gave milk, I'm happy. So this is the amygdala's hippocampus connections. Hippocampus is important for our emotions, and because of our emotions, we do the work. I'm happy to work with these muscles and brain, and if anybody has any damage in that brain cells and the muscle cells, I am there. That's why I read about muscles and brain. So I have fixed emotion towards this brain and muscle issues. That's why I am doing this. So everybody is connected to their emotions. Hippocampus, that is the one which will help you to come out and tell the body to do what it has to do. The study reports a novel neurotype in the hippocampus, defines its functional role in the brain, discloses its connectivity with other nerve cells and brain areas, and progresses the understanding of brain circuits underlying fast brain waves that are often associated with memory. For example, I want to go home, my mom. Very fast, huh? Happy. Don't need to think so much. No packing, nothing. Just go hit mom. Imagine my mother-in-law. Slow, steady, pack properly, think properly, go and take blessings. So brain is under work. My mom, brain is zero work, neutral. So everything is circuited, given by hippocampus.
Ma'am, great example. Very good example.
Thank you. So now, what are the techniques? What are the magics? How we can do these magics? DRG neurons are pseudo bipolar neurons with a peripheral branch that innervates their target organ and a central branch that carries the somatosensory information in the spinal cord. There are few tablets which I cannot obviously disclose everything, and a lot of experiments going on labs even till today. The experiments are in such a way they wanted to even clone the whole body. So when they want to clone a whole body, can't they clone a muscle? So experiments are on. We have to catch up those things. So we
Ma'am, if they can clone the whole body, then I think should be able to even clone the muscles.
yes, they will. They are. Only thing is permissions. They need to check the negative impacts, because whatever the advanced techniques we have done, this body is very complex to understand. Though everybody knows about cold, cough, fever, common. From my childhood, I'm getting this, I'm hearing this. Everybody has to face even at least one day. But can anybody tell how many days that fever will be there for that particular person?
No, nobody can say.
See, such simple issue also body can make it complicated, can make it very simple and give it away. So that is what they need to really wonder and careful. Then only these things can be let out. One of that part is stem cell therapy. That has come in Bombay Neurogen Hospital. They are doing a lot of work on this stem cell therapy. So many children and adults, cerebral palsy, everybody are trying to get these kind of stem cells. If you can see, there are two identical cells. So what happens, no? These stem cells has the capacity of duplicate anything. I can become Pinakinji. So I can become Vivek Rao sir. So my cell is like tuck, 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 tuck. It will go match, match, match. So let's see if it can match any organ. So that's what it will go search for. Okay, so then we have deep brain stimulation. This is another magic I've seen in Spain. I mean, really. Usually we read it in Google, we see YouTube videos. Sometimes these YouTube videos, I'm literally worried. Are they making it or they're really treated well? But I've seen it in Spain. The moment the deep brain stimulation is done, it's like a small motor control in their hand. They switch it on, these particular cells will be activated, and their motor movements are much better. They're like anybody, normal. They eat, they drive, they walk very fast. Oh. The moment it's switched off, shivers because muscle got dead. Till then, highly aggravated and activated. Okay, so deep brain stimulation is another thing we can think of. Progress. How many patients did I see any progress? Zero, because the patients whom I have seen itself is too less. Really, frankly, nobody comes to us because they think it's the life over, or medicines, taking care by nurses, all these things, financial issues, too much, and depending on another person to bring them to the hospital, take to the hospital. And unfortunately, India doesn't have these foreign systems like automatically wheelchair getting into the bus stop, bus, trams, nothing of that sort. Definitely, any handicapped person in India has to depend on 2, 3 people. So many issues. And so I need to tell, many doctors keep thinking that they are living like this, that itself is happy. And okay, anyway, lifespan will go down, no? So how much will you try? It's okay. These are the attitudes I have seen. So very less experience for me. Okay, but what I think of is, why can't we think of quality of life? Though I'm perfectly fine, yeah, my body movements and everything fine. Tomorrow, you never know. But this moment, this day, I'm happy. I'm doing something to somebody. I've eaten my food. I took water without anybody helping me. I've done something. I did this. Let's try for this. Quality of life. Less help from anybody. Do your best thing. Try to be happy in what you do. Try to learn every day so that you don't think of wasting of your life. Early detection and treatment helps extension. Definitely. Of course, I know it's very difficult, but trying to find these problems much, much early instead of thinking, oh, this is only small shiver, or okay, maybe I'm not able to. No, think about it early, hit it early. You will do much, much better than what we are doing now. A revolutionary assistive technology being developed by GP Dr. Nick with a team of researchers at the University of Bath, hopes to offer people with conditions such as motor neuron disorders new ways of communicating via a computer. Of course, this computer is not for early people who are still able to talk and walk a little bit and all that. There are people who cannot literally say a word, or it takes really long time to find a word. So what he did was a small camera and a stimulator in the ear to the smallest muscle possible. The moment I can twitch that muscle, it is activated, computer is activated, and it will be scrolling the letters. So again, if I stimulate my ear, that letter is picked up, T. And again the scroll, H, A, N. Thank you. That's how our computer also works, right? So this is the decode they could find. Yes, and this is how they could improve their quality of life rather than thinking of what life would be later. So the next part of our presentation we are coming up to is Muscle is also my favorite. First, the brain, because it's nerve cells and very fast. Muscles also are my favorite, but then we need to put effort to the muscle. Little more extra physical thing. Yeah. So, but then the muscle also gives us miracles. So, why are we bothered much of the muscle? Can we think of body as a separate thing? Yes, I cannot eat myself or I cannot walk properly, but I'm able to think, I'm able to look at you, I'm able to comment on you. Why am I not talking? I want only speech. My physiotherapy is okay. Even if I don't walk is okay, but I want to comment. I want to speak. No, thank you. We need the body. Not perfect, but at least push. Okay. So relationship of the body posture is very, very, very important to the speech. Why is it important? Because if you can see this picture, pink color is muscle. The white fiber which is all around that pink color fibers are muscle fascia. It's something like skin to the muscle. I have this muscle. I'm pulling the skin, the muscle also goes up. I'm not pulling the skin, the muscle. So I don't need to literally take the muscle. I'm not taking the muscle. I pull the skin, the muscle is spreading by itself. Okay. And you know what they say? Muscle is more powerful than bone, and muscle fascia is more powerful than the muscle. This white network which you are seeing is muscle fascia, and muscle fascia is the one which will get cut first. Then the muscle is dislocated. But if I connect the muscle fascia, muscle automatically tries to compress by itself and gets back its energy. Okay. So, what are these two people doing? These skulls. One skull is straight here. Another skull is front like this with the chin front. So can you see the stretch of that thread or the connections? The moment the neck is coming front, we just don't need to feel bad that if we are your neck or head is dropping down. Nowadays, everybody's head is down only. No 90 degrees because of the phones or whatever. I don't know what they're doing, but everybody's neck is like this only. So we need to see how much these muscles are connected to our body, to our face and speech. I was introduced to this myofunctional therapy, posture and muscle fascia connections by Dr. Suzanne Kodani, Basel, Switzerland. She introduced a designed procedure for children with cleft lip and palate. I need to make this as an example for you because children are born with cleft lip and palate. Okay, I don't know what you say in Hindi, but in Telugu it's called Grahana Murru, half cut palate. They are born like this. You know what happens to these children? When the doctor does the surgery and reconstructs the lip and the palate, they don't like it. They don't feel it is being connected. They still act like they have this cleft lip and palate because they don't literally move the lip. They don't use the palate. They don't touch the palate with the tongue for turd. They literally feel they are missing only because they're born with that. And what happens after the doctor does the surgery? Pain, stitches. So those are the parts untouchable. So children will not touch those things. What is the point doctor doing the surgery? Cosmetic appeal. That's all. No functional movements. So what happened? We had to literally give them senses, movements to make sure that They feel the connection and then they started speaking better. So this is how we realize that muscle connections are important for this oral stimulation. And another thing we observed in these cleft lip and palate children are wherever there is defect, if right cleft, they droop down to right side. Left cleft, left side. Either they wanted to hide it or they don't feel it, so drop down. Whatever they feel, highlight. So that's when the whole posture is going towards left side, protruding, right side, not giving any stimulus. So what we need to do? Can we do only surgery and lift this? Then what about this? So we had to do it whole body, lift the head. Automatically they started moving because this is giving pressure. And they felt this is normal. So can you all believe this?
Yes, ma'am. It is believable because if the posture is correct, then the body will react to the correct posture.
Wow, you're intelligent, sir. But as speech therapist, I denied it when I heard it. I said there are so many cerebral palsy children who are talking. So what you're talking is nonsense. Then she showed me one magic. She gave me a balloon. She asked me to blow the balloon. I stood up. I started blowing like this. Then she asked me, why did you stand up? Why didn't you try blowing the balloon just sitting like that? Yes, we can do certain things only when we set certain things. So singing, why can't I sing just lying down or bending? The moment if anybody asks me to sing, I'll be set right and start singing because I need power. Balloon blowing, I need power. The moment you need power, you need the body to be straight and set. If now, as of now, I'm already speaking. I don't need extra power to speak. So I can sit and speak, lie down and speak, crawl and speak. But I need extra power. I have some problem in my body. Then I need to set my body and speak. So let's see how you can set your body. These are the different problems we face. I might fall in this some abnormal crunchy positions. Nobody is, many people don't have this good posture. Somebody has forward head, thoracic, kyphosis, like crunch their back. Somebody put their lumbar back. Some people will be putting their legs front. So everybody is not correct in their postures all the time. I agree. But what happens if your posture is wrong is what you need to think first. So if at all your posture is wrong, like that skeleton is going all teda, one side it is pulling, one side it is going up, then even the respiratory mechanisms, your way the muzzle moves from one side to another side, neutral control of the tongue, everything is disturbed. Okay. So what is important is this white fiber which is covering the muzzle crazily. Muzzle fascia. That is what is important. Difference between the bone, muscle fascia or connective tissue. Connective tissue, it's a thin casing of connective tissue, primary collagen. You know collagen, right? Any scar, collagen is what which will help to repair and makes it feel no scar. After some time, no scar. Okay. So that is the elasticity capacity of the muscle fascia. It has, stabilizes, encloses and separates muscle and other internal organs. Muscle ki boss, muscle fascia. Bone boss, muscle. Okay, so all of our bosses are muscle fascias, which we very much have. You all have good muscle fascia. Use it to bring back your muscle strength. Use the muscle to bring back your better postures. Use your better postures to give a good speech. Generally, I give this example. If in Andhra we used to have these kind of beds in olden days, where if the bed is becoming looser, they'll pull one by one threads so that the whole mat becomes stronger. Right? The same way the whole body works. So this is how we will try to give exercise to our children in our clinic, from foot, stretch all the muscles, give the muscle strength, go till the head and release the mouth muscle and the forehead. That's the end. From toe to head, we spread the muscle in such a way that evenly the body is helping you to do everything, whatever you want. Yeah. So what are the oromotor tools which we are talking about? Do we always have to depend on our own body to help ourselves to speak better, move better and everything? No, not all the time. Sometimes we can take help of these assistive devices, but not depend on these assistive devices. These devices will help you feel the sense, help you with the first 2 attempts of the motor movements. Once you memorize those motor movements by feeling which muscle is stimulating. For example, I'm like, so from here I'm like stretching. My tongue is going up. So next time what I do, if anybody asks me to put the tongue up, I'll think from here only. Not only the tongue, directly to the tongue. No. Always what happens with the patients who come for speech therapies, base of the tongue is the issue. Lifting the base was difficult. Tip, we can lift because we can even put it with the depressor, hand, anything we can do. Base, who will go inside? The patient only has to do that. So we need these tools to stimulate the base of the tongue, so that once they get their senses, oh, I touched something here, there is something here, there is something called base of the muscle. Then the more it's memorized, something called muscle memory will help you lift the tongue again. Okay, muscle memory is what will help us in gym also. Muscle memory is the what which will help you even do driving. Initially, when we start driving, oh, I need to put the gear, I need to put the accelerator, brake, steering, think of something, signal, so many things. But the moment you are used to driving, muscle memory automatically puts the brake. Before you even see the danger, who is telling the leg to go press the brake? Muscle memory. It's automatic, auto system. Yeah, so if you memorize this exercises much more and multiple times, muscle memory is the one which will help you to do more activities. Even this is the base of the tongue and soft palate. Many a times I see, oral stress from here. The moment you open your mouth wider, this will trigger down and the soft palate is given chance. More gap, more voice out, then more natural. Otherwise, the muscle strain is what we are hearing. Okay. Then what we have, this is U trainer. These are the instrument. This is the instrument, particularly they use it for trumpet musicians. Trumpets. They need lot of lip strength for hours together. Usually we cannot do such things. But they will do it by using these kind of tools. So we implemented these tools to our patients who can try to improve their lip strength. That pointer which you see, one side it's narrow, and you see the black rubber bands which are, there are 3 black rubber bands which are rolled onto the pointer. So what happens is, the moment I ask them to hold the pointer with the lips, they'll hold it like this. The more they are able to hold it, I'll increase the rubber band, one more, two more, four more, five more. So because of the rubber band weight, they still hold on the pointer, then the strength of the lip is increased. Okay. Similarly, we have ballow vent, that blue color vent. Generally, when we were students, we were told to use balloons. Ask them to hold the balloon and blow the balloon, then speech is automatic because you have the lip control, you have the air. So what else you need? But holding that thin balloon with the lips was itself difficult for our children. So this ballow vent, this blue color vent will help hold a bigger tube, not the balloon, but a tube. So at the other end of this balloon vent will have the balloon. So once I blow the air, the in the vent, the balloon blows up and it stays for some time. Then if I give it to the child feels it very easy to blow the rest of the balloon. So it reinforces them. Oh, I increased the air in the balloon. Yes, great. So they'll keep trying to do that again and again. Okay. And this chewing tube, I think many people must be already using. If you see, generally chewing tubes, positive thing is we can never chew it. It's too hard. But it has that flexibility. That's why it helps us to use the jaw movements. And chewing tube, just because of its name, many people think it's for swallowing or people who cannot chew. But I believe, and yes, some of my fellow therapists also believe that chewing tube also helps you speech because we have to keep giving multiple movements when we speak. Those jaw movements are necessary with the chewing tube. Yeah. So the last thing is U trainer. This U trainer is the one which will spread your lips horizontally. And this will help you open your mouth wider. Okay, so which will give you air to come out. Even if you're saying hi, it won't be I, it will be hi, air coming out. Hi. Okay. Yes, these are the things which I would like to share with you till now. I don't know how much new information I gave you. We can talk a little more if you have particular doubts or opinions on certain things and you wanted to know more about it. If I know it, I'll share it with you, or I can get back to you once I find out. Thank you all. You are teaching us to live, and you are the reason we get up and work every day. Wait for new. Let's listen for more updates. Never sleep.
Yeah.
చాలా బాగుంది మేడం. ఇవన్నీ చాలా కొత్తగా ఉన్నాయి.
Thank you.
Thank you, ma'am, for a fantastic presentation. With regards to assistive devices, I would like to share a few information. There is one thing called Tobii eye scanner. There is one device which is called Tobii eye scanner.
Okay.
Yeah. So that is one very good assistive device which keeps a check on our eyelid movements, and with your eyes you can start typing using that Tobii eye scanner. And recently And recently, Google has also created one app. I will share all that information with you.
Please do. Thank you.
Yeah. And ma'am, the devices that you showed, these are all new, and thank you for sharing all the information. Whatever you shared is very important for all of us. Thank you very much, ma'am.
Thank you all for being
Now
here.
I would like to ask anyone, if anybody has any question, you can raise your hand and you can unmute and ask, ma'am.
Madam Garo, very good presentation. Excellent. New technique, new instrument. చాలా బాగుంది.
Thank you so much.
అవును. I've seen చాలా చూసాను, చాలా ఇన్ఫర్మాను, బట్ this information చాలా బాగుంది. We got many ideas.
Oh, great. Nice.
And I am an orthopedic surgeon. I was operating until 2019. I stopped operating after the COVID.
And I'm talking to you about bone, muscle, and muscle fascia.
No, don't worry. It was very informative for all of us.
Thank you so much. Thank you for your patience. And it's so nice.
Each specialty is important. Just because I'm an orthopedic doesn't mean to say I know everything. No.
Yes. Yeah, I agree, sir. I completely.
No. Sorry, information very nicely told, and it was very simple. Complication చేస్తే అర్థమయ్యలేదు.
Oh, yes.
అవును. చాలా నీట్గా ఎక్స్ప్లెయిన్ చేస్తున్నాను మీరు.
I'm happy it was helpful to you all. Very glad.
Thank you, man. Can I come back to you for any more information?
Yes, sir, please. I would love to help you if I can really.
Yeah, what I will do is I will share the email ID of ma'am, so you can all communicate with ma'am via email.
Thank you.
Ma'am, kindly please stop sharing the screen so we can.
I have to see. Stop share.
Yeah. Thank you, ma'am. Or, ma'am, now I would like your suggestion on how important it is to keep our speech going on, because recently what I have seen is that many people who are not able to communicate are facing a lot of difficulties, because in this disease there are a lot many issues, and many people have literally lost all their communication via speech or even via uh, other means of communication.
Okay.
So I need your guidance as to, because I'm each and every day I'm telling my warriors to regularly do speech therapy, oromotor exercises, then facial muscle stimulation. All this I regularly tell everyone, but I don't think so they take it seriously. But only after they see that their speech is going bad, they message me personally, Pinakin bhai, what to do.
We'll do one thing, sir. We'll hypnotize them. See, what we have to do, we can try this. If all of you have one WhatsApp group, which is very common now.
Yeah.
You can add some of people like me, speech therapist, occupational therapist, or somebody like me. So as and when we think of, some exercise is important for this group, we take a video and push. We take a video and push. Irrespective of whether the person needs or not, we keep sending you informations or videos and things like that. The moment you ask a question, we will be more alert, of course. Even if you don't ask questions, the moment we think of you, something is important to you guys, some article, some picture, some tool, some exercise, we will send it to you. This is hypnotism. Feeding.
Very good. Very good idea.
So let's see if even if they get help or doesn't get help. See, automatically, for example, I stay with my husband from I think 20 years or 22 years. So before he tells me, I know what he will tell. Hypnotism, what to do. So even before anything happens, they will do automatically. The brain will tell them to do the exercise. Let's try this and give more feed. They will also will not get discouraged in between. They'll get engaged.
Okay, ma'am. All right, ma'am. Thank you. Mohammed Rafiq, you have your hand raised. Can you unmute and speak? Mohammed Rafiq. हाँ, आप अनम्यूट करके बोलिए मोहम्मद जी. मोहम्मद जी आप अनम्यूट करके बोलिए सर. No, maybe by mistake. Yes.
Yeah, maybe by mistake.
Now, ma'am, one more thing. Can you, if you have a few minutes, can you guide us on the main speech therapy exercises that we compulsorily need to do? If you have a few minutes of time.
Yeah, I have 5 minutes because 3 I need to jump to something else. Okay. See, the point here is I've seen the other recordings which you have sent, sir.
Yeah.
Previously, you had one more therapist who were talking. Yes, she gave a lot of information. I'm very happy now. Now you know everything about it. And she mentioned a lot of importance on respiratory issues, right? Respirometer, breathing, increasing your vital capacity. Okay. See, you need to understand, and even if a patient comes to me, the first thing what I do is this only. You are breathing now for your heart, kidney, liver, body to function. But you need to breathe for your speech separately. Whatever you're breathing now for your body to function is not enough for your speech. It's something like, though you know running, you need to prepare for Olympics. So increase your vital capacity to an extreme of a Shankar Mahadevan singing and things like that. That itself will give you a lot of boost and lot of volume to flow out. Even if you give little movements, the articulators are tongue and teeth and the jaw thing. They'll automatically start moving and give you the space to flow your speech out. So first thing first is increase your vital capacity to Olympics level. Then is your postures. I know it will be drooping, but rise again. Pull it again. Pull with another help. I've seen many people who are right side paralyzed. With left side, they keep doing things. It's okay. Keep pulling yourself. Make sure you're talking all the time. Make sure you're reading books. Make sure you're communicating and socializing with people. If other person is finding it difficulty to understand and doesn't have patience to listen to you, it's his karma. You do your job. You eat their brains. It's okay. Whoever will enjoy. Otherwise, record yourself, how good you are speaking on your phone. Today, whatever you recorded, record the same thing next day also and see if you have done better job or worse job. Every day it will not be same. talk, but talk. Do not be quiet and calm. No phones because we already lost few nerve cells. So the moment you take phone or TV and try to sleep for long hours, the rest of the nerve cells also are under rest and pruning. Increase another dendrite, increase another neuron, learn something new, do something new. Repeat same thing which I have done, but no being quiet. And one more thing you can do, any person can do is make sure you write all the letters which you can pronounce. Filter out what are the sounds which you are not able to get it. Sa is not coming out. Lot of effort. Tongue is not. Ha, it's not going up. Write it big. Keep attempting. Keep attempting. Compensatory mechanism. I think the other also has mentioned compensatory mechanisms. Those will help you. See, these compensatory mechanisms are nowhere in the books. Nobody, no therapist can tell you, oh, if you can't put your tongue here, put it there. No, it is the person who creates the compensatory mechanism. Your body will only know, oh, if not here, if I cannot eat from the left side, I can eat from the right side. How? Only the body can know. Nobody can put their brains inside. So you keep doing it, you will get that idea one day. Your compensatory mechanism will help you by filtering and keep doing the work. Actually, to say you people should be more busy than us.
Ma'am, let me give you some good news. Last year, when I was talking almost 1 year back, I had to stretch all my nerves of my neck. But nowadays, if you see, I can speak easily. And every day when I speak, everybody tells me that your voice is improved. My speech is much more clear than before.
And
So I'm
imagine
regularly doing speech therapy, and every day I speak with more than 15 to 20 warriors. I motivate them. I try to bring positivity within them.
great.
And Vivek knows I make everyone smile. See, right now, Vivek is smiling.
Yes, that's the best thing. That's the magic. He has it all. You don't need it. Chalo, then I got to go now.
Yeah, so on behalf of both the groups, Ataxia and Healing MND, ma'am, आपका बहुत
Thank you. Thank you.
Thank you, madam. Thank you once again.
Thank you.
much, ma'am, for connecting today and imparting knowledge and guideline. Thank you, ma'am. And also take out time in the future, whenever you have time, we can do speech therapy exercise under your guidance. Thank you again, ma'am.
Thank you.
Thank you, madam. Thank you.
Welcome, sir. Thank you.
చాలా బాగుంది మీ ఇన్ఫర్మేషన్ చాలా
Yeah, thank you all for joining today. बहुत बहुत धन्यवाद.
Thank you, Pinatan bhai.
ओके सर, बहुत बहुत शुक्रिया. हम कल फिर वापस मिलेंगे. हम कल अंताक्षरी खेलेंगे. विवेक जी अंताक्षरी खेलेंगे कल.
शाम को मिलते हैं ना कल क्यों जो आज करे सो अभी कर.
ओके, नहीं अभी नहीं, अभी नहीं.
अभी नहीं, शाम को करते हैं.
नहीं, कल करेंगे. कल मैं आप सबको इनवाइट करता हूँ.
हम दोनों रहेंगे. हम दोनों.
ओके ओके सर, बहुत बढ़िया. थैंक यू. बहुत बहुत धन्यवाद. थैंक यू.
Thank you very much.
Salute, sir. Salute. Okay.